Rahman Rahim. In the previous lecture, we have studied the biosynthesis of purine nucleotides by the different pathways. Now we will discuss the catabolism of purine nucleotides. The purine nucleotides catabolism starts with the removal of phosphoryl groups from the nucleotides, and this removal of phosphoryl groups is catalyzed by the enzyme nucleotidase. Then after the removal of phosphoryl groups, the remaining compound are the purine nucleosides. Then the purine nucleosides are further degraded into its components, that are the purine bases and the ribose sugar. And this reaction is catalyzed by the enzyme nucleoside phosphorylase. So in this reaction, the uh, inosine gives the purine base hypoxanthine, xanthosine gives the xanthine, and guanosine gives the guanine, and the ribose sugar is splits off as ribose 1 phosphate. The nucleoside adenosine is first deaminated to inosine by the enzyme uh, adenosine deaminase. Both the purine nucleosides, both the uh, purine bases, that is the adenine and the guanine, when they are catabolized, they are converted to the xanthine. So xanthine is the common breakdown product of adenosine or the guanosine, and then xanthine is converted to uric acid by the enzyme xanthine oxidase, and finally the uric acid is excreted out of the body through the urine. Now we will see that how the purine nucleosides are degraded. In this diagram, we see that adenosine is first deaminated by the enzyme adenosine deaminase and is converted to inosine. And then inosine uh, is degraded into its components, that is the purine base hypoxanthine, and then the ribose sugar is removed as ribose 1 phosphate, and this reaction is catalyzed by the enzyme purine nucleoside phosphorylase. In this reaction, 1 phosphate inorganic phosphate is utilized. Then the nitrogenous base hypoxanthine is oxidized to xanthine, and then xanthine is further oxidized to uric acid, and both these uh, oxidation reactions are catalyzed by the enzyme xanthine oxidase. So in this way, adenosine is broken down into uric acid. On the other hand, the other nucleoside guanosine, it first splits off into its components, the nitrogenous base guanine and the sugar and the ribose sugar as ribose 1 phosphate. The enzyme is same, that is the purine nucleoside phosphorylase. Then the nitrogenous base guanine is deaminated. We have seen that in case of adenosine, first of all deamination takes place, then further reactions comes on, and in case of guanosine, that deamination takes place uh, after the separation of ribose. Then this guanine after deamination is converted to xanthine, and this reaction is catalyzed by the enzyme guanase, and then xanthine is oxidized by xanthine oxidase to uric acid, and finally the uric acid is excreted out of the body through the urine. This diagram shows the catabolism of purine nucleotides, that is the AMP, adenosine monophosphate, inosine monophosphate, and guanosine monophosphate. In this diagram we see that first of all dephosphorylation of AMP takes place, and after dephosphorylation it is converted to adenosine, and then adenosine is deaminated by the adenosine deaminase to inosine. Similarly, the inosine monophosphate is first dephosphorylated and is converted to inosine, and this dephosphorylation reaction is catalyzed by the enzyme purine nucleotidase. Then the inosine is degraded into its sugar moiety, that is ribose 1 phosphate, and the nitrogenous base hypoxanthine. Then hypoxanthine undergoes oxidation to xanthine, and xanthine is oxidized to uric acid, and these oxidation reactions are catalyzed by the enzyme xanthine oxidase. The purine nucleotide guanosine monophosphate is also first dephosphorylated by the same enzyme purine 5 nucleotidase, and then after the removal of phosphoryl group, inorganic phosphate or phosphoryl group, this guanosine is degraded into its components, that is the guanine and ribose 1 phosphate, and then guanine is deaminated by guanase into xanthine, and then xanthine is oxidized to uric acid. So in this way the purine nucleotides are degraded into uric acid, which is the end product of their catabolism, and this is excreted out of the body through the urine. Now there are some disorders of the purine metabolism. The most important one is the hyperuricemia leading to the gout. Normally the uric acid concentration in the serum in males is 3 to 7 milligram per deciliter, and in females it is 2.5 to 6 milligram per deciliter. Hyperuricemia is the condition in which there is accumulation of uric acid in the blood. So the level of uric acid raises above the normal level in hyperuricemia, while gout is a metabolic disorder which is associated with overproduction of uric acid and then the deposition of urate crystals in joints and other tissues. So it is clear that hyperuricemia is only the raised level of uric acid in the serum, while gout is a clinical manifestation which results due to the accumulation of urate crystals in the joints and other tissues. Now the sign and symptoms of gout. The monosodium urate crystals are deposited in and around the joints, and these deposits are commonly known as tophi. This accumulation of monosodium urate crystals in the joints results in inflammation of the joints and pain in the joints. that results in painful gouty arthritis. The first of all, the joint which is involved in gout is the first metatarsophalangeal joint, that is the uh, big toe, metatarsophalangeal joint of big toe of foot. Then the sodium urate crystals, they can also precipitate in the kidneys, which leads to the renal damage and stone formation in the kidneys. This condition gout can be diagnosed um, by detecting the uh, sodium urate crystals in the synovial fluid. The synovial fluid from the joints is first aspirated, and then it is examined under microscope for the presence of sodium urate crystals. Now the gout is of two types. One is primary gout and the other one is the secondary gout. Primary gout is the inborn metabolic error, which leads to the overproduction of uric acid. This is mostly related to the overproduction of purine nucleotides. In the primary gout, some enzyme defects are involved. One is the defect in the PRPP synthase. Normally, the PRPP synthase is under the feedback control by the purine nucleotides like ADP and GDP. However, some variants of PRPP synthase are not subjected to feedback regulation. So they leads to the increased production of purines. Another enzyme which can be defected is the PRPP glutamyl amidinotransferase. As we know that this PRPP glutamyl amidinotransferase catalyze the conversion of PRPP to phosphoribosylate amine, and this reaction is and this enzyme is controlled by the purine nucleotides. So when there is lack of feedback control of this enzyme, this leads to the excessive production of purine nucleotides. The other defect is the hypoxanthine guanine phosphoribosylate transferase deficiency. The HGPRT deficiency leads to the clinical syndrome called the Leishman syndrome. This the deficiency of HGPRT leads to the accumulation of purine bases, that is the hypoxanthine and guanine. And when there is excessive accumulation of hypoxanthine and guanine, they leads to the excessive breakdown of purine bases, leading to the excessive production of uric acid. Similarly, with the deficiency of this enzyme, the PRPP, phosphoribosylate pyrophosphate, also get accumulated. As we know that PRPP is an activator of PRPP glutamyl amidinotransferase. So this excessive amount of PRPP, when activates the PRPP glutamyl amidinotransferase, it leads to the excessive production of purine nucleotides, which are then finally degraded in larger amounts and leading to the production of larger amount of uric acid. Another condition which leads to the excessive production of nucleotides is the von Guericke disease. This von Guericke disease is characterized by the deficiency of glucose 6-phosphatase. So with the deficiency of glucose 6-phosphatase, the glucose 6-phosphate cannot be converted to glucose. So there is increased concentration of glucose 6-phosphate. This increased amount of glucose phosphate is utilized by the hexose monophosphate pathway. So when there is overactivation of this HMP pathway, there is increased production of ribose 5-phosphate, which leads to the excessive formation of phosphoribosyl pyrophosphate and ultimately the purine overproduction. And this von Guericke disease also uh, associated with the increased activity of glycolysis. As we know that with the deficiency of glucose 6-phosphatase, there is an excessive amount of glucose 6-phosphate, which leads to the activation of glycolytic pathways, which leads to the excessive production of lactic acid. And this lactic acid competes with the excretion of uric acid through the kidneys. So when there is excessive amount of lactic acid in the body, then the excretion of uric acid is decreased, which get accumulated in the blood, leading to hyperuricemia. The another type of gout is the secondary gout. In secondary gout, the hyperuricemia is due to some various diseases which cause increased synthesis or decreased excretion of uric acid. There are some conditions in which there is increased degradation of nucleic acids. These conditions are cancers like leukemia, polycythemia, lymphoma, and then psoriasis. And there are some also conditions which are related to the increased tissue breakdown. These conditions are like starvation or trauma. Then there are some conditions in which the excretion of uric acid is decreased. These are the chronic renal disease, in which the uric acid excretion is reduced. There is another condition which is present with the similar clinical conditions or manifestations like the gout. This is the pseudo gout. Clinically, the pseudo gout is similar to that of gout, but the difference is that in gout there is accumulation of monosodium urate crystals, while in pseudo gout there is accumulation of uh, calcium pyrophosphate crystals. So this is the biochemical difference. Clinically, the both symptoms are similar. Another condition is the Lesch-Nyhan syndrome. As we know that Lesch-Nyhan syndrome is due to the deficiency of hypoxanthine guanine phosphoribosyl transferase deficiency, which leads to the raised levels of hypoxanthine and guanine bases, which undergo degradation and leads to the excessive production of uric acid. Also, there is accumulation of PRPP, which stimulates the enzyme PRPP glutamyl amidinotransferase, which leads to the excessive production of purine nucleotides, leading to excessive degradation and excessive production of uric acid. This Leishman syndrome is also characterized by some neuropsychiatric symptoms like the spasticity, aggressiveness, and self-mutilation. Self-mutilation is the condition in which there is uh, biting of lips and fingers and hands. That is, the patient himself bites his own fingers, lips, and hands. Thank you.